140 over 90. Your doctor just read out those numbers and you nodded like you understood. But did you really understood? Most people have no idea what their blood pressure numbers actually mean. And that ignorance could literally cost you your life. Stay with me because in the next 6 to 7 minutes, I'm going to break it all down so simply that you will never be confused again. Welcome back to my channel. I am Nurse Emmy, a qualified nurse, a microbiologist, and an health educator dedicated to making health information simple, accessible to everyone. So, if you are new here, hello and welcome. Make sure you hit that subscribe button and turn on your notification so you never miss a video. So now, let's get straight into today's topic, which is blood pressure numbers and exactly what it means. So first thing first, what exactly is blood pressure? Simply put, blood pressure is the force of your blood pushing against the walls of your arteries as your heart pumps it all around your body. Think of it like water flowing through a pipe. If too much water is forced through a pipe that is too narrow, the pressure builds up and eventually that pipe can burst. The same thing happens in our body when your blood pressure gets too high. Now, when your blood pressure is measured, you get two numbers. For example, 120 over 80. These two numbers tell your doctor a lot about what is happening inside your body. So let me break down exactly what each numbers means. The first number, the top number is what we call systolic pressure. So there are three stages of high blood pressure. Stage 1 is 130 to 139 over 80 to 89. At this stage, your doctor will likely recommend lifestyle changes and may consider medication depending on your overall health. So stage 2 is 140 or higher over 90 or over then 90 or higher. This is serious. Medication is almost always required alongside lifestyle changes. And finally, we have the hypertensive crisis. This is a reading above 180 over 120. This is a medical emergency. So if you or someone you know ever gets a reading this high, go to the hospital immediately. Do not wait. Do not manage it at home at all. So now I want you to understand why high blood pressure is so dangerous, because a lot of people think, oh, it's just a number, I feel fine. And that is exactly what makes high blood pressure so deadly. It is called the silent killer for a reason. So you can have dangerously high blood pressure and feel absolutely nothing. No headache, no dizziness, nothing at all. Meanwhile, inside your body, your heart is being overworked, your artery are being damaged, and your risk of heart attack and stroke is increasing every single day. High blood pressure is one of the leading causes of stroke and heart disease worldwide. So please do not ignore your numbers just because you feel you are okay. So here are the 3 things you can start doing today. Number 1, know your numbers. Check your blood pressure regularly at a pharmacy or clinic. And you can actually even get the machine at home. We have the digital one, which is available for everyone to use at the comfort of their home. And number 2 is reduce your salt intake immediately. This one is one of the fastest way to bring down your numbers naturally. And number 3 is, if your doctor has prescribed your medication, take it consistently. Do not stop just because you feel better, just because you feel okay. It manages the condition, it does not cure. Yeah, it does not cure it, but it actually manages the condition. So before we go, let's recap everything we've talked about earlier. So your blood pressure reading has two numbers, which I say the upper one is the systolic, and bottom one is the diastolic. So the normal blood pressure is below 120/80. Anything above that is your blood asking for attention. So elevated means make lifestyle changes now, while the stage 1 and the stage 2 means see your doctor immediately. And above 180/120, go to the emergency room right away. So high blood pressure is silent. It has no symptoms, but it is deadly. So the most powerful thing you can do for yourself today is simply go and check your numbers. Knowledge is protection. Yes. So if this video actually helps you, please give it a thumbs up. It helps more people find this channel. So share it with everyone you know who has never had their blood pressure checked before, or someone you know is struggling with hypertension. And if you haven't subscribed yet, hit that subscribe button right now for more simple health education every single week. I am Nurse Emmy, a microbiologist and an health educator. So I will see you in the next video. Till then, take good care of yourself and be safe. Bye bye.